This is breaking news.
Happening right now, Governor Hochul is providing a COVID-19 update and getting a booster shot. Let's go.
Arturo Perez is here, the CEO of Borican Neighborhood Health Center. Thank you very much for hosting us here. And also be having the Director of Nursing here be doing something. I'll be in that chair to have something administered. As Nadel Etienne, and will be joining us shortly as well. So here we are, big day. Really proud to be at this fantastic medical facility. Every chance I get, I come out and thank the people who showed up day after day when many people were able to zoom into life, zoom into their jobs, and they showed up and were providing life-saving health care. And so I will always be grateful. And that is why it was important to come to this particular site to talk about some very, very good news related to boosters. And we're going to be making some changes to our guidance based on positive trends and with hospitalizations and cases. But before we get into that, it's always important to talk about where we are in the COVID story. It's been going on a very long time, about 28, 29 months. And basically, we're seeing numbers that are similar to what we've seen before. Again, that dreaded peak there that was fairly early in my tenure. And we saw what happened when we had literally 90,000 cases back on January 7th. Today, our 7-day average is about 3,400. So again, cases per 100,000. Back then, an extraordinary 366 cases per 100,000. Today, that number is 17.8. So again, you can see a phenomenal trend the progress we've made till now. But I track these numbers like a hawk. It's the first thing I look at in the morning, and I make sure nothing happened by the end of the day. Hospitalizations, again, this is 100,000. Let's look at the hospitalizations. Those have stabilized as well. That's about 10,000 at the peak. Now we're down to 2,200, and that's the 7-day average. So we are seeing major declines in hospitalizations. Another good news story. That's our statewide average. So now the good news is we have a booster been approved by the FDA and the CDC, and that gives us a new tool to fight the virus. And thank God we've had vaccines and vaccinations and booster shots to prevent death and serious illness. And that is what the narrative over these many months has demonstrated, that people who are boosted, you still may contract COVID. Yes, you may, but you'll have a much less severe case, you're less likely to end up in a hospital, and certainly much less chance of death. So for the first time ever now, we have boosters that are approved that are target specific variants. We haven't had that before. These boosters that we'll be talking about today and now be widely available today are to target the Omicron variants BA4 and BA5, which has been the predominant variants for a number of months now. There's others ones on the horizon we're always tracking, but as I confirmed with Dr. Bassett earlier today, that these are still the predominant variants circulating around this country. So again, having a booster shot tailored to a specific variant is significant. It's the first time that we've been able to achieve that, and that makes me very hopeful that this will be an extraordinarily effective booster shot. And so I look forward to getting my shot momentarily, because I do shake a lot of hands. Just think about 4,000 hands on Sunday alone, or Monday. So I'm excited to be immunized, and I want others to share in that excitement and know that they can take control of their own health by getting something as simple as a booster shot that is now going to be available at your local pharmacy. Literally today, there are people in line filling out the paper to get a booster shot right here at this facility. So they are now out there. Individual doctors, individual pharmacists have been requesting their supply. Thank God there's no shortage. That was our crisis last year. When there was such a severe shortage, we had to determine based on age and categories of work, and people who are most vulnerable could get the booster shots. And now, today, they're widely available. So you just call up, make an appointment, go online, make an appointment, your own doctor, or one of the countless pharmacies that we have in the neighborhood. So anyone over 12 and up is eligible to receive the Pfizer booster. I believe it's still 18 for the Moderna. So if you've had your last shot, your last booster 2 months ago, early July, you are now eligible to get this one as well. So get the new Omicron booster. And we're also going to be talking about, continuing to use every tool available to us. And as New Yorkers, we have one shared goal, and that is to get through this together, put an end to this era. It's been long, it's been painful, and New Yorkers have done an extraordinary job, and I can't thank them enough for what they've done to help us go from the depths of despair, the depth of darkness, as the hardest hit community in America, almost the world at the time. But we also want to make sure we get through this together. So again, getting vaccinated boosts is our best shot, but also we have to restore some normalcy to our lives. And so we'll be talking about a new normal starting today. Department of Health will be issuing new guidance regarding masks based on the CDC guidance. And starting today, masks will be optional. You'll be starting to see these signs. This is our subway sign. So places like shelters, correctional facilities, detention centers, and yes, mass transit. You'll see this little character, and I'm told that's a ponytail off to the side. Do you all see the ponytail? Okay, I just want to make sure I'm not the only one. Masks are encouraged but optional. This is what you're going to see on our subways and our mass transit throughout the state of New York. This is buses upstate, this is transportation everywhere, so we're very, very excited about that as well. So big progress, but also the message at the bottom is very important. Let's respect each other's choices. What that means is you choose not to have a mask. That is your personal decision. You'll do your own personal risk assessment of who you're exposed to, your own vulnerabilities, where you work. You make your own determination. But do not judge your fellow passengers on what their choices are. Let's be respectful. So we want to make sure that we handle that in a mature way, as New Yorkers can and should do. But also remind everyone that masking requirements will remain in effect at adult care facilities, as well as other health care facilities regulated by the Department of Health, while there's still the variant at large. And so I know this is a big change. The MTA will be rolling out the signage, but basically we're going from mandatory to optional. So that is what we're talking about. And so I want to thank everyone who's been complying on our transit systems for 28 months. A long time. I know for many it became second nature, but it's always been a visible reminder that something is not normal here. And it was there for the right reason. It protected health. And now we're in a far different place than we had been as we continue to watch the trends. This is not a one-day snapshot. This is watching the trends, and we're seeing a stabilization of those numbers. So I want to thank everyone, the New Yorkers who sacrificed, stepped up, and they've done a great job. They really have. And I still expect I will see many people on the trains and subways and walking down the streets. I walk the streets of Manhattan almost every day, and I see people still wearing them. That is their choice. We encourage them to do that. So these are encouraged but optional. So that's how we're going to make sure that we get to a new place. So I'm very optimistic. And I'm very optimistic that we'll be assuring each other's respect for this. But as we talk about this, I want to make sure we are getting kids back to school. That was my other #1 priority. We talked about this in July. We talked about our fall surge plan on August 22nd as we gave updates to make sure that parents know we welcome the public school kids back to school in the city tomorrow, all over the state. Many are going back today. And also say we'll continue to do everything we can to keep our children safe in schools. So I want to let everybody know we're going to continue watching the numbers. We're watching global trends. We're watching for variants. We're watching for any updates and vaccines. But we do believe that we're in a good place right now, especially if New Yorkers take advantage of this booster. That is how we get back to not just a new normal, but a normal. And that is what we're striving for. So I'm excited that we've been able to achieve that. We also said when we get kids back to school, we wanted to make sure there's enough test kits. So we kept our promise. We got over almost 3 million test kits out already. So when they go back to school, if they need to be tested, they're stockpiled. We've sent them to private schools, charter schools, public schools. They are all over the state. We have plenty stockpiled. This is important to me as I have conversations with Catherine Garcia, head of our state operations, to make sure that we are not ever in a vulnerable position again with respect to supplies. So we have amassed over 15 million test kits are in inventory right now to be able to handle any potential surge coming up, because if a surge comes, as we saw last winter, Omicron wasn't even a variant. It wasn't defined until the end of November, and immediately there was a run on test kits. And we worked tirelessly to make sure we had enough so when kids went back to school in January that there would be no barriers, that we had plenty of test kits, and that's what gave people the confidence to know they can go back. So we will always be aggressive, make sure we leave no stone unturned to make sure New York is positioned to protect our citizens. It's my #1 job. So we're always watching the data. Our fall action plan is up and running. And again, the last thing I'm going to encourage you to do, go get your shots. All the members of the media, you can get your shot before you leave here today. So just sign up. And so with that, let me turn it over to Dr. Bassett and thank her again for her extraordinary service to the people of the state of New York.
Thank you, Governor. So the governor has really covered our news today very comprehensively. I think the big news on the booster is that for the first time, as she's noted, we have a booster that is tailored to the dominant variant that's circulating. Until now, we've gotten a lot of value out of a vaccine that was designed to address the initial variant that was identified in Wuhan, China. Now we have a vaccine that is tailored to the circulating variant, and we have a lot of confidence this will bring people much more protection. You know, people may feel confused about the number of boosters and shots they're supposed to get, but we can keep it simple by saying that if you're 12 and over and you've gotten your full primary course of vaccines, that's the first and the second shot, you should get a booster. It doesn't matter how many boosters you've had before. If it's been 2 months since your last shot, you should look into getting another booster. For the 12 to 17-year-olds, it's the Pfizer, and for anyone 18 and over, either the Pfizer or Moderna vaccines are available as boosters. These are being shipped out to the commercial chains, and I think that those are quite ubiquitous. I've just been to one myself, just up the street from here. So just check and see, make an appointment, go get your shot, and while you're at it, remember that flu season is coming. We hear from the Southern Hemisphere and Australia that they've had a difficult flu season, so remember to get your flu shot as well. On masking, as you've heard, we continue to require masks in hospital and healthcare settings, including nursing homes. Nursing homes are an important setting because, as we know, the elderly, people 65 and over, have borne the brunt of severe illness and mortality during this. We also are requiring masks in adult care facilities, but in other settings, we urge people to pay attention to their community level. The CDC makes that available. When the community level is high, which it is no longer in New York City, it was for a long time, the CDC recommends that people wear vaccines. And of course, all individuals may have their own reasons. I have a 94-year-old mother who's agreed that I can invoke her because she's the reason that I'm very careful about wearing a mask. And additionally, testing continues to play a role. So all of these together, getting all of your shots, that you're eligible for, paying attention to your context. I'm confident that we're going to be heading into a winter where we will be able to contain COVID. So thank you very much, Governor.
Thank you. All right, now for the show. Let's get this over with.
You wore the right outfit. Short sleeves.
Do you like shots, Governor, or not necessarily?
I'm immune to them. I think somebody. But you know, to the extent that a photograph of this makes someone say, I'm going to do that as well, that's fine. Be careful. I really need more people to do this. We can get through this. There's no reason why we can't just say, this is done. And everybody in New York gets a booster. We'll be there. I'd be very proud to say that New York, you're the most aggressive in terms of getting this out to people. And that's important. Let's just do a smart thing. The last one I did was during the budget process. This was still not better.
We were just chatting about it.
Each hand or no each hand? You recommend this one? You decide that first.